All right. Dr. Stevens, there has been lately some news out there about dentures. Actually, there has been news out there about denture cream, Fixodent, that there is problems with it and that there is too much zinc in it. And since the gums, basically a denture cream is a denture adhesive. It's you glue your denture on it, especially when they start getting wiggle-woggly and start shifting around because they're a little old and your bones have been shrinking. So lots of people keep gluing and gluing and gluing. Must be awful. I mean, thanks God I never, had to do that and never will, hopefully. But in any case, now there is some news out there that, that glue contains zinc. And while zinc is a good thing, apparently too much is used because it's at the gateway of the blood vessels and it goes into the body and it poisons people and they get actually nerve damage. Tingling in their hands. I saw reports where people apparently it's not 100% proven as such. Probably takes decades to prove that, and by that time it's all over and denture companies will use something different. But those people were mentally and physically damaged. They were vegetables. I mean, they were still talking, but obviously not like you and me. What did you hear about it? What's true about it? What's your suggestion?
Well, I'm not a scientist or a research expert, but I do watch those, the research and the scientific information that comes out, specifically regarding dentistry. And the concerns with the denture adhesives, the validity of it and the consequences of it there are some compelling evidence that there are links to these problems that these patients are having. The best problem is the best thing to do is to eliminate anything that might be at risk for you, and anything artificial sticking to your gums or touching your body in any way that can be absorbed and has a potential of causing physiologic problems should be avoided. There are solutions to people with the need to use a lot of denture adhesive, such as a well-fitting denture, one that gets good suction and retention and does not move around, so they do not have to use the denture adhesive, or even better, an implant-supported denture, which will help it and totally eliminate that risk of the possibility of some of the ingredients of the denture adhesive affecting them physically.
Well, because with an implant-supported denture, where there is a couple, 2-3 implants in it for each arch, so to say, whatever. But so with that one, a person will never have to use an adhesive because it's always fixed. The gums don't shrink anymore, and even if they do shrink, they're supported with the implant, and it's sitting there, it's stable. And you told me in another video, you can taste your food again. You can actually bite into an apple. You can chew on a prime rib, or on a spare rib or whatever. And whether you sneeze or otherwise have a big laugh at Thanksgiving dinner, you don't have to worry about your teeth falling out. They just won't fall out. And the cosmetic part, meaning the caved-in feeling, is taken care of. It's beautiful. It's as close to the good teeth. It's like a world of difference from normal one. So why would anybody not want to do that? Because I heard there's 30 million people running around with dentures, and most of them have no implant-supported dentures.
The biggest difficulty is people not really realizing how good it really can be, and wanting to make that investment in their well-being and the security of their laugh, their smile, and the more efficient chewing and eating.
And that must
it's just making the decision to do it. It's an investment that they have to make in their own health.
Right. Well, I think it looks like, to me at least, that you hit it on the nail, because we all get relatively conditioned. Well, that's how it was for mom, grandma, and even the average medical doctor, as we get 40, 50, and we complain about something, because, well, you're just getting old. And then yet, we sometimes see people 30 years older having not at all that problem, and they say, well, that's genetics. Not necessarily, not that it is not a little bit, but the truth is people who take good care of themselves and do do the right thing and avail themselves of the new technologies actually can avoid a great many of the problems they think are normal at a certain age.
Absolutely. Absolutely. Just because our grandparents had that problem doesn't mean that we have to. You know,
right. So
many of them died of cholera and polio. That doesn't mean we want to have the problem.
Right. So what you're saying is that problem could possibly exist. So if a person has tingling fingers, extremities, weak muscles, things like that, he should go and visit at least a general physician, have it checked out. That guy might send him to a nerve doctor. Would you suggest that he does that?
Absolutely. If you have any symptoms like that, go to your family physician, and he may refer you, or she may refer you to a specialist. But get it checked out, and if they find that there's anything bothering you,
wearing those dentures, right? Those adhesives.
Stop using that if you think that's the case. Stop it and get it checked out, and then look for other solutions other than the adhesive.
Well, I would stop it immediately. You know what I mean? I would immediately go and get that implant denture. That's not necessarily just a plug for implant dentures here. It's just, again, what it is what it is. For instance, like a couple decades ago, there was this huge controversy in Florida about some patients maybe getting AIDS from a dentist. It's never been proven, but the fact is this: no dentist, no normal dentist, no sane dentist, and no sane patient would have doubted and said, okay, let's heat sterilize. We're not sure it is the case, but we're not sure it isn't the case, so obviously we want to do everything possible. Let's get rid of, which could be a good thing. On top of it, it couldn't be comfortable to have glue in your mouth. Damn it. That just couldn't be a good thing in the first place, just from comfort. You know what I mean? Yeah.
Yes.
Good. Well, all right. Here you have it. So basically, there is maybe something to it, and proven or not, we don't need to have to wait years for somebody to prove it to us. It's uncomfortable in the first place. Go and get a better bite and eliminate what could potentially be a problem.
Absolutely.
Thank you very much. I appreciate your candidness.
Thank you.